Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider. Welcome back, everybody, to another episode of Explain This. I'm with the star of the show, Robin Riddle. Robin, how's it going?
Doing good. How about you?
I'm doing wonderful. I'm excited for today's topic. You mentioned this to me before we started recording. We're going to talk about serrapeptase today, and
Yeah.
and I want to learn more about it. What's up with this thing?
Okay, so serrapeptase is a proteolytic or protein dissolving enzyme. It was originally developed or discovered in silkworms. So it's produced by a good bacteria that's in the gut of silkworms, and it's what allows them to dissolve their silk cocoons without actually hurting themselves.
Well, I didn't expect it to go there.
I know, right? I don't know who was messing around with the bacteria in the gut of a silkworm, but they found something really cool when they did it.
Well, there we go. Okay. Serrapeptase from silkworms.
Serrapeptase, yeah. So in humans, serrapeptase actually has a lot of really powerful abilities. Its function is to break down non-living proteins. So
Okay.
that means things like scar tissue, mucus, even the fibrin that's contained in blood clots. It can break that kind of stuff down
Mm,
without harming our healthy tissue.
interesting. Okay.
So a lot of really cool benefits with serrapeptase. First thing is it can help to lower inflammation. So a lot of chronic conditions, arthritis, endometriosis, chronic sinus infections, chronic pain, all that tends to be related to excessive inflammation. Serrapeptase helps by breaking down the proteins that fuel the inflammatory process, like bradykins. People often report reduced pain, reduced swelling, faster recovery when they are on serrapeptase.
Okay.
Like I said, it has a fibrinolytic action, meaning that it helps to break down fibrin, which is involved in scar tissue, but also involved in blood clots. So in some situations, we can use it to support cardiovascular health. It can actually help to reduce some of the plaque buildup and keep blood moving through the arteries.
Hmm.
Because that plaque buildup contains fibrin. So that's the protein that's involved in clot formation, also contributes to arterial like stiffness or hardening. So serrapeptase breaks down the non-living fibers like fibrin, so it can help to reduce arterial inflammation. It can help to soften some of the plaque. It improves blood flow. And like I said, it breaks down or brings down inflammation, so reduces swelling in the blood vessels.
So, is it mainly something you would want to consider for heart health, or when you said mucus, I'm like, would it help with like allergies?
Well, yeah, that's the thing. It can do so many things. So it's also mucolytic, so it breaks down and clears up mucus.
Okay.
So chronic sinusitis, chronic bronchitis, like long hauler respiratory symptoms, it breaks down mucus. So
Hmm.
it can help with all those sorts of things.
Okay.
Um, it can help even in the fertility world. So because again, it breaks down adhesions, it can help us with endometriosis.
Oh.
It can help with blocked fallopian tubes, pelvic adhesions. It can even help reduce like post-surgical scarring if you've had some kind of surgeries within the reproductive tract.
Super
Um,
interesting.
yeah, so it can help with anything like adhesions that could be interfering with like egg release, fertilization, implantation. It can help to break all of that down.
So it's a breaking down function. Anything that needs
Hmm.
to be broken up, serrapeptase could
Yep,
help.
yep, yep. So it can also break down biofilms. So it helps with biofilm disruption whenever we have chronic infections.
Hmm.
So biofilms are, it's kind of like a bubble that bacteria and yeast and things like that surround themselves with. And they put themselves in their own little happy bubble. So then whenever we try to go kill these things in the body, this bubble protects it.
Hmm.
So serrapeptase breaks down that protein matrix that the bacteria creates its bubble from. So then they can't hide from the immune system or the antibiotics or antimicrobials or whatever it is that we're using. The serrapeptase takes away their level of protection.
Interesting.
So we use this in protocols for like Lyme's disease, SIBO, Candida, chronic, like embedded chronic UTIs, parasitic infections. We use this along with our antimicrobials or antibiotics or whatever it is that we have to use for that. We can use serrapeptase along with it to make treatment work better. It can also help with neurological support and helping with neuroinflammation. So post-concussion inflammation, brain fog, again, with the long haul stuff, or mold illness, or chronic neuroinflammation coming from things like MS or a neuro-Lyme disease. Serrapeptase can help with all that too.
So it seems like it's very, you use it for a very particular purpose. It's not something that, okay, now I take this every day.
Right. We need to have a reason.
Okay.
So reasons that I've listed, like I said, also respiratory stuff. So people with chronic asthma, COPD, it can help to thin the mucus in the lungs or decrease inflammation in the airways. So it's really focused around either breaking down something that we don't want in the body or getting rid of inflammation are the big uses here. We also recommend this for patients sometimes. We do a lot of pellet therapy. If we have patients that start having worse scar tissue buildup with their pellets, especially like keloid scarring, serrapeptase can help to break that down. So if we have a patient that we're going in and doing repeat pellets every couple months and they're building up scar tissue in that area and we're starting to have trouble putting the pellets in, we can put them on a regimen with serrapeptase and it can help to break down that scar tissue and make their pellet placement easier.
Wow, that's a great use case.
Yeah. So yeah, it's not just a general supplement like, hey, everybody should be on serrapeptase.
Right.
Not that kind of supplement. But it has a lot of uses. So lots of different reasons to try it, but definitely one you want to have a specific reason for it.
Is there, when you mentioned with pellet scarring and stuff of that nature, in my head, I was like, okay, is it like a topical thing for that case, or is this all supplemental, all
supplemental?
Okay.
Yeah.
Okay.
Yeah. And so key things with dosing this, it does have to be taken on an empty stomach. If you take it with food, it's just going to break down the protein that's in your food and it's not going to go out into the body. So this needs to be a minimum of 30 minutes prior to eating or at least 2 hours after eating any meal.
Can you say the prior again? Two before?
30 minutes before or 2 hours after.
Okay.
Yeah. It needs to be an enteric coated capsule, meaning that it's going to bypass stomach digestion and move on into the intestines where we want it to get broken down.
Okay.
Dosing wise, start low with this. So again, have a reason for it, talk to your provider about it. But if you're starting dosing, most people start around anywhere from 10,000 to 40,000 SPUs, which it stands for serrapeptase units, once or twice daily. For things like scar tissue, biofilm disruption, those sorts of things, I work up to doses as high as 120,000 SPUs daily. Yeah. So there's a wide range of dosing there. You've got to know what you're using it for. And this is not a one-time dose helps everything. You do have to be consistent with this one to get the benefits of it.
And I mean, I'm sure there's some things that are, maybe a little bit more chronic and you would want to stay on it long term, or are you kind of encouraging patients?
Potentially.
Okay.
Potentially. So like if I've got a endometriosis patient that we're trying to help to naturally break down some of those adhesions and prepare the body for fertility, that's something we're going to be on a little bit more long term.
Okay.
But in the same caveat, if you are a fertility patient who is actively trying to get pregnant, we don't want to take serrapeptase post-ovulation because we don't want to mess with anything with implantation or fertilization or anything like that. So again, that's where provider is very helpful.
Yes.
So just some potential negatives or cautions with serrapeptase. If you're on a blood thinner, you definitely need to talk to your doctor first. Because serrapeptase does break down fibrin in the blood, it can have mild blood thinning effects. So if we're already on a blood thinner, we've got to be really cautious there. For some people, it can cause some digestive discomfort like nausea or bloating, especially at higher doses. So just be aware of that. Avoid if pregnant or nursing because there's not research on that. And like I said, if you're taking it for fertility, timing really does matter. So we do not want to take it post-ovulation if you're actively trying to get pregnant.
So there's a lot of strategy around it, a lot of use cases that you can use it for. Is there anything in office that you've been, using it more for, or anything you're noticing, or are you kind of across the gamut?
So I think across the board through performance medicine, we've recommended it to a lot of patients for scarring specifically.
Yeah.
That's probably the widest use that we've used it for in performance medicine. Me specifically, a lot of gut stuff. I'm always treating gut-related things, and Serrapeptase, again, is really good in combination with other supplements to help get rid of any kind of gut infections. And then the fertility side of things, endometriosis has become so common.
Yeah.
And, surgery can be beneficial, but surgery also can take, 3 to 6 months to get in with a surgeon, and then not everybody wants to go that route, and it's not always beneficial. So if we can do something like this and improve fertility rates, it's a good bypass and still help with endo.
Are your endometriosis patients, are they staying on this, more longer term?
Again, depends. Most of the people coming to me are typically endometriosis actively trying to get pregnant.
Okay.
And so we're doing more of that split dosing.
Okay.
But if I've got someone young or someone who's past reproductive years and we're just trying to control symptoms, you definitely could stay on it a little bit more long term.
Super interesting. Serrapeptase, is there anything else that we need to make sure we cover on this? Because one, I'll be honest with you, I've heard of Serrapeptase. I've talked about it. I did not realize how many different, uses there are for it.
Yeah.
Before we sign off, is there a brand you like? Is there a type of Serrapeptase that you like, or?
I cannot remember the brand name. It's a white bottle with a red label on it. I have some sitting in my medicine cabinet because I try everything.
I love that. Guys, look for the white bottle with the red cap.
Red label.
Red label.
Yeah. It's in my protocol and everything. Absolutely cannot remember the brand name of it at all.
What we'll do, guys, is we will we'll get that information for you and we'll put it in the description below. That's amazing. Robin, is there anything else we want to cover with Serrapeptase?
I think that covered it all.
Perfect. Well, Robin, you explained it today. Guys, y'all named it. We're going to be back, as always, next week with another episode with Robin Riddle. Robin, we appreciate you.
Absolutely.
See you guys.
Don't go away.